Gentleman yields, and my colleague from Texas, Ms. Jackson Lee, is recognized for 5 minutes for questioning.
Let me thank the chairman and ranking member. I was just in judiciary, so I'm somewhat delayed and may be asking questions that have already been asked. But let me start with the Principal Deputy Administrator of the DEA, the Papadopoulos, and really hone in on the DEA's work with respect to opioids and the fact that fentanyl, which is synthetic, is found in drugs for medical use and is sometimes used to lace other drugs, and as well are sold online, come in pink pills, multicolor pills. How difficult is the fight for fentanyl, and what are the elements that the DEA uses? I know this on the criminal side, you deal with scheduling of drugs. We've not yet scheduled fentanyl, but how difficult is this fight?
Yes, thank you, ma'am. So we are using all the tools that we have available and the authorities that we have been given to battle this unprecedented epidemic that we're facing right now. As you mentioned, we are having millions of pills come into the United States. 6 out of 10 have a potentially lethal dose. That's up from 4 out of 10 last year. So we are committed to doing everything we can to prevent the overdose deaths that are happening throughout the country.
Well, what is your, let me get you to be more extensive, everything you can, but what are are you targeting certain areas? How do you incorporate the fact that there's medical uses? You know, are you seeing a criminal element that is separate and apart from the cartels? Because fentanyl is everywhere. Can you comment on that, please?
Yes. So we are domestically, I mentioned Operation Last Mile, which resulted in cartel distributors' arrests in the United States. Also, we have Operation Overdrive, which is data-driven, and it focuses on areas of the country that have a high number of overdose deaths and drug-related violence. And we're working with our state and local partners to identify those areas. Most recently, we are in 57 cities in 36 states. Phase 1, which ended last year, resulted in significant decreases in fatal shootings and homicides in Philadelphia and the Kensington area. And Phase 2 is ongoing, and Phase 3 is coming soon. So we're doing that. We also have Operation Overdose Justice, which focuses on deaths resulting from fentanyl, where we partner with state and local counterparts to bring the most appropriate charges when somebody does die, either through a fake prescription pill or if fentanyl is mixed with another drug.
Let me thank you very much. I am in the business of stopping fentanyl and particularly the impact that it's had on our children. I want to ask Mr. Chester what is being done as relates to research for treatments and opioid addiction, but particularly the impact on school children. And at this time, Mr. Chairman, I'd like to introduce into the legislation, my legislation, which is Stop Fentanyl Now Act of 2023. And I hope that there will be an opportunity for this legislation to be reviewed in this committee, Judiciary, and I know that there's an Energy and Commerce component. But included in here is the ability for more institutions to use the strips. Some states outlaw them as being a criminal element. And so, Mr. Chester, you want to comment, particularly focused on school children and the crisis we have?
Yes, Congresswoman, thank you very much. The first thing is our strong emphasis, and particularly in the National Drug Control Strategy, on youth prevention. And this is not only preventing at the individual level, but looking at the environmental factors that may lead to eventual substance use. That's the first thing. The second thing is you mentioned fentanyl test strips. Would also like to mention naloxone and increasing the availability of naloxone to get it in the hands of everyone who needs it so that anyone who suffers an opioid overdose, who doesn't need to die, that overdose can be reversed with the use of naloxone. And those are two important components of harm reduction. And the National Drug Control Strategy, this is the first time that harm reduction has been mentioned in a National Drug Control Strategy. And the last thing, when you talk about treatment, we have wonderful professionals at the National Institutes of Drug Addiction at NIDA who do research on this. I think the most important thing that we can do now is reduce barriers to treatment, particularly medication treatment for opioid use disorder, to ensure that everyone who needs treatment has access to it. That's probably the most critical, important thing that we can do in order to take the oxygen out of this illicit supply that's being pulled across our borders.
Mr. Chester, thank you. I wanted to end on your testimony because if we can cut the desire, then the supply has nowhere to go. And it is in our schools. My legislation, Stop Fentanyl Now Act, does with NARCOM, does the strips, and you have indicated it is a holistic approach. I just want to end, Mr. Chairman, by, I'm not sure if I did get a answer, but I'm asking unanimous consent to introduce in the record the Stop Fentanyl Now
Without
Act.
objection.
And additionally, I want to introduce into the record, fentanyl is dominating headlines, but there is a more comprehensive drug problem happening in Texas. And it goes on to talk about the broader crisis, synthetic opioids, and not taken alone. And so healthcare and law enforcement officials are dealing with multiple deadly drugs at once. That means we must cut into the desire. I use that term because it's desire because you're addicted. And so I thank you, Mr. Chairman. I hope you will consider, and the ranking member, your courtesies, but I hope you will consider the legislation because we have to find a multiple level of dealing with this. To the other witnesses, my time is gone, so I just want to express my recognition of your presence here, Mr. Kagan, Mr. Mandeek, Mr. Durham, and did not get a chance, but I'm well aware of the work that you're doing and challenges that we all have. I'll yield back.
Yes, ma'am. The gentlewoman yields.